Artificial ventilation. Artificial ventilation is called artificial respiration. It means of assisting or stimulating respiration, a metabolic process referring to overall exchange of gas in the body by pulmonary ventilation, external respiration and internal respiration. Types of artificial ventilation: artificial respiration, cardiopulmonary respiration, respiratory therapy, breathing, mouth to mouth breathing, prone to pressure method. How does it work? The ventilator pushes a mixture of air and oxygen into the patient's lung to get oxygen into the body. The ventilation is held as a constant amount of low pressure called positive end respiratory pressure PEEP in order to keep their air sacs in the lung from collapsing.
Next, we'll see about the artificial respiration. Artificial respiration is the breathing induced by some manipulative technique when natural respiration has ceased or is faltering. Such techniques, if applied and quickly and properly, can prevent some deaths from drowning, choking, etc. Cardiopulmonary resuscitation. Cardiopulmonary resuscitation is an emergency procedure that combines chest compression, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore the spontaneous blood circulation and breathing on a person who is in cardiac arrest. In CPR, the first thing is scene safety. Look for the response of the patient. If he is not responding, then call help. Emergency number would work. By the time help arrives, check the pulse of the patient. If the pulse is not present, you have to check the pulse within 5 to 10 seconds. The pulse check. Then you identify the center of the chest and you need to start CPR or chest compression. Chest compression should be 30 and then followed by 2 rescue breaths. Follow the cycle for 5 times or 2 minutes. Check if the pulse is returned or not. If you're not comfortable giving breaths, you can give hands only CPR or compression only CPR. That could actually save a patient's life. So in the end, the motive is to save someone's life. Check if the pulse is returned or not. Now let's see CPR for infants. If you find your baby unresponsive or not breathing, tap the baby foot and see if they respond. Never shake a baby. If the baby doesn't respond, yell for help. If someone comes, ask them to call 911. Check for breathing. If baby is not breathing or is only grasping, they need CPR right away. Carefully move the baby to a flat, firm surface above the ground. Start with compression. Place 2 fingers in the middle of the baby's chest, just below the dimples. Give 30 compression, pressing straight down 1.5 inches. Push hard and fast, at least 100 compressions per minute. Let the chest rise all the way back up after each push. Give 2 breaths by putting your mouth over the baby's mouth and nose. Gently give enough breath to make the baby's chest rise. Keep alternating 2 breaths and 30 compression and the baby responds. If the baby is still unresponsive after 2 minutes of CPR, make sure you take your baby with yourself. Carry the baby with you and make the call yourself. You can continue compressions by giving breaths with the baby in the football hold. Prone pressure method of artificial ventilation. A method of artificial respiration in which the patient is placed downward pressure then being rhythmically applied with the hands to the lower part of the thorax. It is also called Scaffold method, which is the Scaffold method. Now let's see about the Scaffold method. In the Scaffold method, the doctor kneels near the patient's waist. The second step is put palm on patient's loin And the third step is by bending forward, doctor will apply pressure. And the fourth step is pushing abdominal viscera up to bring about expiration.